Triceps tendonitis is a nagging cause of elbow pain in active people. In this video, I'll discuss what the injury is, how it develops, as well as treatments to help you recover quickly and return to sports. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, I've talked about a triceps tendon rupture fairly recently on this video channel, and basically that's a rupture of the tendon as it attaches to that bony prominence of your elbow or your olecranon, and that almost always needs surgery. This is more of an overuse injury rather than a traumatic event where you get inflammation of that tendon that can be aggravating. You're going to typically get it in overhead athlete sports where you're constantly pushing away, maybe you're constantly throwing. You see it a decent amount in baseball pitchers. And if it's truly an inflammation of that tendon, typically that's something that does very well without surgery. Period of time where you avoid that activity, a short period of rest from pitching or whatever that activity is. Sometimes anti-inflammatory medications. I'm not a huge fan of those long-term, but that can be helpful. Ice to that area, physical therapy, all can be helpful. Typically, you avoid cortisone for tendon injuries to decrease the risk of tendon rupture, but I know that anti-inflammatories are something that people do a lot. That, again, is typically not something that needs surgery unless it's not really a tendonitis, but you get sort of an area of tendinopathy or tendinosis, a small area of degeneration within the tendon. That can be a little trickier to get to heal. The equivalent of that would be tennis elbow. That's a similar type of problem, or Achilles tendinosis or Achilles tendinopathy, similar type of problem. But if you get a small area of degeneration within that triceps tendon, that's a little trickier to heal with some of those treatments. And so that's where sometimes it needs surgery to go in and cut out the small area of diseased tendon and then close that up or reattach it to bone. But it's where sometimes the regenerative treatments potentially could be helpful. Peptides that people ask me about, things like BPC 157, in theory could be helpful. PRP, platelet-rich plasma, injected into that area a lot of times can be helpful. Some people will do things like exosomes or stem cells trying to get that to heal. All of those regenerative treatments, just so you know, are considered experimental by the FDA. I'm not promoting any of that. I just have a lot of people that ask me about those, so those potentially could have a role. Maybe it'd be modalities like shockwave treatment or low-level laser therapy or red light therapy. There could potentially be a role there as well to try to get those that tendon to heal. But if it's truly just an inflammation of that tendon, a tendonitis, that can do very, very well without surgery. And even if it's more of a tendinosis, there are a lot of options to try to get you back to sports and back to exercise without needing surgery. Now, if you've had triceps tendonitis or some other elbow injury, I'd love to hear your experience. Please leave those in the comments below this video. Just understand I can't give you medical advice if you ask for it in a question in those comments. So what I try to do is address that topic, address that injury in a future video. Make sure to subscribe to my video channel, click the bell to be notified when I release a new video or when I start a new live stream like my monthly Ask Dr. Geier live shows. Thanks so much for watching. I look forward to helping you feel, look, and perform better than ever.